Hello and welcome again. Today we'll be talking about my favorite tool, Supplemental Nursing System. This particular tool was designed for women who were unable to breastfeed either due to a breast surgery or for moms who adopted and wanted to experience breastfeeding. This is a starter kit. The kits that are for longer use could be purchased at baby supply stores such as Target or Baby R Us. The kit comes sterilized, comes with a 2-ounce bottle, and you can place either breast milk or formula in it. A thin tube. I'd like to compare it in consistency to al dente angel hair pasta. It's just as thin and flexible. A little stopper, and we're gonna use this. We're gonna just pull the tube right through and it stops the flow. And one-way valve. Now when you assemble this, and this is really important, the white membrane comes right into this indentation here, and you have to make sure that the shoulders come through all around. Make sure when you're touching this and you're getting this ready for your patient, you have washed your hands prior to opening the package. Once this filter is in, you place it facing down. Think of this sort of as a nipple, and you milk, you face it down. As I said, you can put either formula or breast milk into this container, and for the purposes of this demonstration, we're going to use formula. The recommended amount is anywhere between 10 or 15 milliliters to as much as you need. Depends on either your hospital practice or doctor's orders. If you have a brand new newborn, less than 24 hours of age, probably 15 to 20 will be more than sufficient. You pour this in. And you can place the top on. Just a quick reminder or a quick review. This fits right onto the standard 2-ounce bottles, as well as the 1-ounce pump bottles. Okay, so if necessary, or if you need to use a larger amount, if you need to, you can put it right on the bottle. I'm going to screw this on. Make sure this is sealed. And you're going to need a little clip. This clip is an important part of this assembly as it holds the bottle in place. You're going to prime this by squeezing the nipple once or twice, just so that you have some amount in here. You're going to open your stopper, and you can actually see as the fluid starts running in. I'm going to seal it, close this off, and talk about this a little bit. The SNS, or Supplemental Nursing System, can be used for any infant who needs a supplementation, either because mom is not producing enough, or the baby is too sleepy at the breast and just needs a little stimulation, doctor's orders, low glucose, anything like that. The only requirement is the baby is able to latch on and suck. If the infant is unable to latch on onto the breast but can latch on onto the finger, you can finger feed with this device as well. What you would do is you would place the tube along your finger of choice and let the baby nurse on this. When you're placing this particular device along the nipple, you would place the tip of the tube just at the side of the nipple, and the tube should not bypass the edge of the nipple. There's a paper tape that comes with the setup, and mine, another rope is missing, but any paper tape or any gentle tape can be used, placed right over the tube to hold the tube in place. This would be the one way to start the feeding session, is to place the tube near the nipple, secure it, and assist the infant with the latch. If you have a baby that's vigorous at the breast in the beginning, is able to latch on but falls asleep quickly, you can start the baby on the breast, let him or her get on and start nursing, and then place the tube at the corner of the baby's mouth along the nipple. The reason this device is so successful, it works by two methods. One, it works by gravity. The higher the container is hung, the faster it flows. So if I'm going to open this tube and keep the container here, you can see that it only drops one little drop every couple of seconds. The higher the tube, the faster it flows. This helps a very sleepy infant get the feeding he or she needs by promoting the flow. It's instant gratification. You let the baby get the idea when he or she is on the breast, the food is coming. Generally speaking, most of the patients only really need it for a few days. As we remember, the milk comes in somewhere between 2 and 5 days post-delivery. Sometimes they need to use it up to about a week. If you read through the information on the container, it'll say that this particular starter kit is only good for 24 hours. You will notice though in a hospital setting, and the lactations will advise, this could be used for up to about a week as long as the tip of the tube is completely intact. The tube should be rinsed carefully with hot water, as hot as you can tolerate it without burning yourself, after every single use. And the bottle should be washed with soap and water after every use as well. Do not put the soap into the tube. It's too thin and it will not wash out. Hot water is all that's necessary. And remember, before every use, to check the tip of the tube to make sure that it's intact. Discard the setup once the tube is ruined. To disassemble this, as you can see, I have fluid in here as well as in the bottle. Just flip it upside down and you can simply just unscrew this. It's a one-way seal. It will not drip or pour. You can discard the unused portion of your formula or breast milk. Rinse the container, soap and water. To open this particular part up, you squeeze the bottom. You empty out. And then you rinse this with hot water, as hot as you can tolerate it. Remember to educate your patients to open the seal. Okay? That's it.